So my name's Jeffrey Talbot. I'm a physician and I'm an internist at Redmond Regional Hospital. My role in the patient care journey as an internist is the person that coordinates all of the care for the patient from the moment they enter the hospital to the moment they leave the hospital. The patient's primarily my responsibility, making sure the patient knows what's going on, making sure that the right tests are ordered, the right consults are called. I see those as all my job in the hospital. I can remember one gentleman that came in at 5 or 6 p.m. at night. He was an elderly guy, and he had a GI bleed, and he was on anticoagulation therapy. He was very sick. He was probably in his 70s, and when he hit the emergency department, I remember a lot of the family members had sort of given up on him, and it was tough. But you know, throughout the night, working with the nurses, 2 a.m. in the morning, 3 a.m. in the morning, with the residents involved, we were able to actually get him stabilized and bring him back. And the next morning, he was sitting up in his happy self. Now, the neat thing about that is, in most cases, the story would have stopped there. But because we have our social workers and our nurses and our staff, we're actually able to figure out that he had a small memory problem and that he'd actually been taking too many of his anticoagulation medicines. And so before he left here, we had a new plan of care for him. We had him plugged into follow-up. And you know, I saw him a little while ago for a different issue, and he's doing great. And I think that's a really neat thing. Above all else, we are committed to the care and improvement of human life.